So you just learned that you have one or even two copies of the apoprotein E4 gene. Maybe your doctor told you, maybe you did a home test, or maybe you found out that one of your parents is an E4 carrier. And maybe you're freaking out. But once that panic settles, this video is for you. We're going to turn fear and panic into agency and action. In my last video, I walked you through family history and dementia, the difference between a deterministic and non-deterministic gene, and what the apoprotein E gene actually does. We reviewed the difference between carrying the E2, E3, or E4 alleles and their corresponding relative risk of dementia. If you haven't seen that one, I'd start there. The link is in the description. Today, I want to answer the question that every ApoE4 carrier asks. Okay, now what? Because honestly, genetic information without a plan is just anxiety. So that's exactly what we're going to walk through today, a plan. If you have one or even two copies of the E4 allele, or if you know you have a family history of dementia and you just want to learn more about it before you consider testing, this video is for you. But before we get to what to do, let's address one important part of the risk picture, the difference between carrying one copy of the E4 versus two, because it does matter. One copy, also called heterozygous, and most commonly one copy of E4 and one copy of E3, means you have roughly 2 to 3 times the lifetime risk of Alzheimer's dementia compared to the average population, or what we call the wild type, someone with 2 copies of E3. 2 copies, also called homozygous, or ApoE4, raises your risk 8 to 12 times the average population. A study widely cited in NIH literature also indicates that the lifetime risk for E4 homozygous carriers is about 60% by age 85. Carrying 2 copies of the ApoE4 allele is the highest non-deterministic genetic risk profile we know of for late onset Alzheimer's dementia. But here's what I want you to consider alongside that 60% statistic, the other 40%. That means 40% of people who carry 2 copies of ApoE4 do not develop dementia. And I want this to really settle in, because the important question isn't, will this happen to me? The really important question is, what's going to set me apart so that I'm in that 40%? And the good news is that there is a growing body of evidence on just how to do that. But I also want to say, I understand that it can be really hard not to feel a doom and gloom approach to dementia, especially when we have a family history. In fact, for a long time, and still amongst many neurologists, the consensus has been, don't bother testing for ApoE4. There's nothing you can do about it, and it just leads to fear. But I really want to push against this, because practically every day there is new research showing us that there is so much we can do on an individual level to shift our Alzheimer's risk meaningfully, even if, and sometimes especially if, you are an E4 carrier. So let's walk through the 4 overarching domains where the data is strongest and give some examples for how to modify dementia risk for ApoE4 carriers. Number 1, metabolic health. ApoE4 protein negatively affects the brain's ability to use glucose as fuel. This is evident on functional brain imaging starting decades before symptoms appear. Practically, that means ApoE4 carriers have to be extra vigilant about optimizing glucose metabolism and insulin sensitivity. Day to day, that means maintaining a low normal fasting blood sugar, as well as low insulin levels. And I mean optimal, not just normal. Being diabetic is not healthy for these brains, and even trending in the pre-diabetic range really needs to be avoided. Remember, lab results indicate what is normal in the average population. But for ApoE4 carrying brains, that's not good enough. Practically, this means maintaining a healthy body composition, low visceral fat, avoiding ultra-processed foods and refined carbohydrates, considering time-restricted eating, and in some cases, thinking about even the use of GLP-1 drugs. If you're an ApoE4 carrier, addressing insulin resistance has to be at the top of your to-do list. Number 2, cardiovascular risk factors. Hypertension, hyperlipidemia, and atherosclerosis confer a disproportionately higher dementia risk in ApoE4 carriers than in non-carriers with the same cardiovascular risk profile. The SPRINT-MIND trial showed that aggressive blood pressure control, targeting systolic blood pressure to below 120, significantly reduced mild cognitive impairment. The mechanisms are clear. Avoiding high blood pressure helps to maintain our blood-brain barrier while preserving vascular and oxygen supply to the brain. Because E4 carriers may have a less robust blood-brain barrier, it's extra important to have a really low tolerance for hypertension. Now, E4 carriers also have a higher risk of cardiovascular disease, as well as increased cholesterol absorption. So being really vigilant of cholesterol levels, especially LDL and ApoB, becomes extra important. For most E4 carriers, this will mean having a low threshold for being on one or maybe even a combination of cholesterol-lowering medications. But I have to say, I see it all the time. Individuals have a high cholesterol and LDL, but are told, it's okay, let's wait, we don't want to start any medications. I don't think this is a good strategy for an ApoE4 brain. Number 3, sleep. I already told you that ApoE4 carriers are prone to a less robust blood-brain barrier. This is the fortress that doesn't allow toxins in and helps get junk or waste, like amyloid, out of the brain. Sleep is one of the most crucial times for this waste transport, also known as the glymphatic system, to get to work. In fact, deep sleep is when the glymphatic system is on the night shift. So for an ApoE4 carrier, sleep optimization, especially quality sleep, is a priority. Practically speaking, this means not ignoring sleep apnea, treating insomnia effectively, and ideally without sleep aids. Plus building lifelong healthy sleep habits, considering cognitive behavioral therapy and other strategies for healthy sleep. Number 4, exercise. And I'd like to get specific here beyond exercise is good for you. Aerobic exercise at a sustained moderate to vigorous intensity, at least 150 minutes per week, increases BDNF, supports hippocampal volume, and improves cerebrovascular function. Adding resistance training confers additional benefit through improved glucose metabolism and increasing lean muscle mass. That's true for everyone, but here's what's cool for ApoE4 carriers. Multiple studies show that exercise may offer an even larger protective benefit in E4 carriers than in non-carriers. One study showed significant improvements in hippocampal blood flow, executive function, with aerobic exercise that wasn't seen to the same degree in non-carriers. Exercise does so many wonderful things for your brain. It truly is the one pill I wish I could prescribe for everyone, because it's not always easy for us, but it's honestly non-negotiable for the E4 brain. So everything I've described, metabolic health, blood pressure, sleep, exercise, I know these sound like old news, but here's what I want you to take home. They can't just be fuzzy goals. Each of these has to have a target. And the right target for you, especially as an E4 carrier, is not going to be the same as the right target for everyone else. Normal on a lab report means you're in the range of average. And average is not good enough for optimizing cognitive longevity in general, and especially not for the ApoE4 brain. The question isn't whether your fasting glucose is below 100. The question has to become how it sits relative to your insulin dynamics, your body composition, your inflammation, your hormones, and your genetic risk profile, all taken together. And that's exactly what I do in my cognitive longevity program. That's the foundation on which it's built. Not a generic checklist, but an individualized baseline looking at all of these factors brain structure, cardiometabolic health, sleep, hormonal health, and developing targets calibrated to each patient's biology. I think the best optimization occurs with measurement and tracking of data with a plan. And as an ApoE4 carrier, there's too much at stake for guesswork. Here's what I want you to take away. Carrying ApoE4 is not a diagnosis, it is information. When it comes to late onset dementia beyond age and sex, it is the most influential piece of information we have, but it is also the most actionable at any age. And the window for intervention is best when we start early. For E4 carriers, that ideally means midlife, decades before symptoms begin and pathology takes hold. I think I've said before, my youngest patient is 36 and my oldest is 86, but I practice these recommendations with my kids too, who are in their 20s. Because with knowledge and insight, we can make better decisions, and there's nothing more valuable than brain health. If you found this video helpful and you're interested in being empowered with agency to understand and minimize your dementia risk, I welcome you to see my website, learn more, and schedule an introductory call to discuss whether my cognitive longevity program is right for you. It's a non-obligation conversation that I have with everyone interested in understanding more about an evidence-informed strategy for dementia prevention and how my practice works. I'm Dr. Ashanti Gajavira, and while I am a doctor, I am not your doctor. So please seek out your own healthcare provider to address any questions you have regarding a medical condition, and don't disregard or delay seeking medical advice because of something you saw or heard on this channel. I'll see you next time.